You look down and your poop is floating. You flush, but it stubbornly bobs back to the surface like a disgusting life raft. You flush again, still floating. Most people just shrug it off, maybe make a joke about it, and move on with their day. But what if I told you that floating poop could be your body's desperate warning sign about serious digestive problems, nutrient deficiencies, infections, or even life-threatening diseases like pancreatic cancer? While you're flushing away the evidence and pretending it's no big deal, your gut might be screaming that something is seriously broken. That floating stool isn't funny. It's a critical health message you can't afford to ignore. What you're about to discover will shock you, probably make you uncomfortable, but could literally save your life. Stop flushing away the warning signs and start paying attention. Floating poop might seem like a weird, embarrassing bathroom phenomenon that you'd never discuss with anyone, not even your doctor. In fact, most Americans would rather suffer in silence than admit their poop floats and ask what it means. However, whether your stool sinks or floats is actually an important and revealing indicator of your digestive health, fat absorption, gut bacteria balance, and potentially serious underlying medical conditions that absolutely should not be ignored or dismissed. You can laugh about it, feel mortified when it happens, flush multiple times hoping no one notices, but keep in mind that persistently floating poop is essential data and a valuable warning sign regarding our health that we absolutely should not ignore, no matter how uncomfortable or embarrassing the topic seems. Our stool is normally dense enough to sink to the bottom of the toilet bowl. This happens because healthy, well-formed poop is primarily composed of undigested food particles, dead bacteria, proteins, bile, and water, materials that are denser than water. However, when your poop consistently floats, it typically means there's excess gas trapped inside it, or, more concerning, excess fat that hasn't been properly digested and absorbed by your body. Floating stools can vary in frequency, happening occasionally after certain meals or happening every single time you have a bowel movement. The frequency, appearance, smell, and accompanying symptoms all provide crucial clues about what's really going on inside your digestive system. Not all floating poop is dangerous or concerning, but persistent floating stools, especially when greasy, pale, foul-smelling, or accompanied by other symptoms, can signal some very serious and potentially life-threatening digestive problems. So, let's dive deep and see exactly what our body is desperately trying to tell us when our poop floats, and why most Americans are too embarrassed to investigate this critical warning sign. Before we proceed any further, please note that everything mentioned in this video is completely unbiased, thoroughly fact-checked, and carefully reviewed by qualified health professionals, gastroenterologists, and licensed medical experts. With that important disclaimer said, let's jump right in and talk about what it really means if your poop floats and when you should be seriously concerned. Reason number 1. Excess gas, usually harmless. Let's start with the most common and least worrying reason for floating poop: excess gas trapped inside your stool. This is actually the most frequent cause of occasional floating stools and is usually completely harmless and nothing to worry about at all. Here's what's happening. Gas gets trapped in your stool as it forms and moves through your intestines. When enough gas bubbles are trapped inside, your poop becomes less dense than water and floats to the surface, just like a balloon floats in air or a life jacket floats in water. It's simple physics. The gas makes your stool buoyant. But where does this excess gas come from? Several completely normal and harmless sources can create extra gas in your digestive system. When you eat or drink, you naturally swallow small amounts of air along with your food and beverages. Drinking carbonated beverages like soda, beer, or sparkling water introduces even more gas into your digestive system. Eating quickly, talking while eating, chewing gum, or drinking through straws all cause you to swallow more air than normal. Certain high-fiber foods, while extremely healthy and beneficial, naturally produce more gas during digestion. Foods like beans, lentils, broccoli, Brussels sprouts, cabbage, onions, whole grains, and certain fruits create gas as the bacteria in your colon break down the fiber. This is completely normal and actually a sign that you're eating healthy, fiber-rich foods that feed your beneficial gut bacteria. Your gut bacteria naturally produce gases like hydrogen, methane, and carbon dioxide as they ferment and break down the food you eat, especially carbohydrates and fiber. This bacterial fermentation is a normal, healthy part of digestion. Some people naturally produce more gas than others based on their unique gut bacteria composition. If your poop occasionally floats after eating particularly gassy foods, after drinking carbonated beverages, or after eating a large fiber-rich meal, and the floating stool looks normal in color, brown, has normal texture, well-formed, doesn't smell unusually foul, and you have no other symptoms like pain, weight loss, or digestive discomfort, then it's almost certainly just excess gas and nothing to worry about at all. The key word here is occasionally. If your poop floats once in a while, maybe once or twice a week, but usually sinks and you feel perfectly fine otherwise, then you're absolutely in the clear. This is normal variation based on what you ate and how much gas was produced during that particular digestive cycle. However, and this is crucial, if your poop floats every single time or nearly every time you go, this is no longer just about occasional excess gas. Persistent, consistent floating is a red flag that something else is going on, which brings us to the more concerning reasons we need to discuss. The takeaway: occasional floating poop from gas is harmless and normal. But if it's happening constantly and consistently, keep reading because the following reasons are much more serious and require medical attention. Reason number 2, fat malabsorption, steatorrhea, serious warning sign. Now we're getting into the serious territory that most people don't know about. If your poop consistently floats and looks greasy, oily, or shiny, and is pale or yellowish instead of brown, and smells absolutely horrible, worse than normal poop smell, you almost certainly have fat malabsorption, medically called steatorrhea. This is a major red flag that your body isn't properly digesting and absorbing dietary fats, and it can indicate several serious underlying diseases. Here's what fat malabsorption means. When you eat foods containing fats, your body is supposed to break them down with digestive enzymes and bile, then absorb them in your small intestine to use for energy, hormone production, vitamin absorption, and countless other essential functions. However, when something goes wrong with this process, the undigested fat passes completely through your digestive system and comes out in your stool. Fat is less dense than water, so stools with high fat content float stubbornly, often leaving greasy residue in the toilet bowl that's difficult to flush away. You might notice oily droplets floating on the water surface or greasy streaks on the toilet paper. The appearance is distinctly different from normal poop. It looks shiny, slick, or oily rather than matte. The color is often pale yellow, light brown, clay-colored, or grayish instead of the normal healthy brown. The smell is absolutely horrible, distinctively rancid, putrid, or sickeningly foul in a way that's different from and worse than normal poop smell. People with steatorrhea often describe it as one of the worst smells they've ever experienced, and it lingers for a long time even after flushing. Several serious medical conditions cause fat malabsorption and steatorrhea, and you need to know about all of them. Pancreatic insufficiency is one of the most common causes. Your pancreas produces essential digestive enzymes called lipase, breaks down fats, protease, breaks down proteins, and amylase, breaks down carbohydrates. When your pancreas isn't producing enough of these enzymes, particularly lipase, you can't digest fats properly and they pass through unabsorbed. What causes pancreatic insufficiency? Chronic pancreatitis from long-term alcohol abuse, repeated bouts of acute pancreatitis, or pancreatic duct blockages causes permanent damage to pancreatic tissue, reducing enzyme production. Cystic fibrosis, a genetic disease, causes thick mucus to block pancreatic ducts, preventing enzyme release. Pancreatic cancer, one of the deadliest cancers, can block ducts or destroy pancreatic tissue, causing enzyme deficiency and steatorrhea, often one of the earliest warning signs. Pancreatic surgery or trauma that removes or damages pancreatic tissue obviously reduces enzyme production. Bile insufficiency is another major cause of fat malabsorption. Bile, produced by your liver and stored in your gallbladder, is absolutely essential for breaking down dietary fats into tiny droplets that enzymes can work on. Without adequate bile, Fats cannot be digested or absorbed properly. What causes bile insufficiency? Liver disease, including cirrhosis, hepatitis, or liver cancer, reduces bile production at the source. Gallbladder problems, including gallstones blocking the bile duct or cholecystitis, inflamed gallbladder, prevent bile from reaching your intestines. Gallbladder removal, cholecystectomy, one of the most common surgeries in America, means you no longer have a storage reservoir for bile, sometimes causing difficulty digesting larger amounts of fat. Bile duct obstruction from stones, tumors, or strictures prevents bile flow into your intestines. Celiac disease, an autoimmune condition triggered by gluten, found in wheat, barley, and rye, causes your immune system to attack and damage the lining of your small intestine. This damage destroys the villi, tiny finger-like projections that absorb nutrients, severely impairing your ability to absorb fats, vitamins, and other nutrients. Millions of Americans have undiagnosed celiac disease and suffer for years with symptoms like steatorrhea, chronic diarrhea, weight loss, fatigue, and nutrient deficiencies without knowing the cause. Crohn's disease and other forms of inflammatory bowel disease (IBD) cause chronic inflammation and damage to your intestinal lining, particularly in the small intestine where fat absorption occurs. This inflammation prevents proper nutrient absorption and can cause steatorrhea, especially during disease flare-ups. Short bowel syndrome occurs when a significant portion of your small intestine has been surgically removed due to disease, trauma, or cancer, leaving you with insufficient intestinal surface area to properly absorb nutrients, including fats. Certain medications can interfere with fat digestion and absorption, including orlistat, Ali, Xenocol, which is specifically designed to block fat absorption for weight loss but causes steatorrhea as a side effect, and some cholesterol medications. If you have fat malabsorption, you won't just notice floating greasy stools. You'll typically experience other serious symptoms that indicate your body isn't getting the nutrients it needs. These include unexplained weight loss despite eating normally or even eating more because you're not absorbing calories from the fat you eat. Vitamin deficiencies, particularly fat-soluble vitamins A, D, E, and K that require fat for absorption, leading to night blindness from vitamin A deficiency, weak bones from vitamin D deficiency, easy bruising and bleeding from vitamin K deficiency, and neurological problems from vitamin E deficiency. You'll experience chronic fatigue and weakness from calorie and nutrient deficiencies, persistent diarrhea or loose stools, abdominal bloating, gas and discomfort, muscle wasting and loss of body fat, and in severe cases, failure to thrive in children or malnutrition in adults. So what do most Americans do when they have persistent steatorrhea? Sadly, most ignore it out of embarrassment, or they just take anti-diarrhea medications that don't address the underlying cause. This is extremely dangerous because fat malabsorption causes severe nutritional deficiencies over time that can lead to irreversible damage to your bones, nervous system, immune system, vision, and overall health. Additionally, steatorrhea is often an early warning sign of serious diseases like pancreatic cancer that are much more treatable when caught early. The solution is immediate medical evaluation. See a gastroenterologist urgently if you have persistent floating, greasy, pale, foul-smelling stools. They will order tests, including stool fat analysis, measures the amount of fat in your stool. Fecal elastase test measures pancreatic enzyme levels, celiac disease blood tests, and possible intestinal biopsy. Imaging studies like CT scan, MRI, or MRCP to examine your pancreas, liver, and bile ducts, and blood tests to check for vitamin deficiencies and liver function. Treatment depends on the specific cause discovered. For pancreatic insufficiency, you'll take pancreatic enzyme replacement supplements like Creon or Zenpep with every meal to help digest fats. For bile insufficiency, you might need bile acid supplements or treatment for the underlying liver or gallbladder problem. For celiac disease, strict lifelong gluten-free diet is essential. For Crohn's disease, or IBD, anti-inflammatory medications, immunosuppressants, or biologics to control inflammation. Don't ignore floating, greasy, pale stools. They're not just embarrassing, they're a serious medical warning that your body desperately needs help. Early diagnosis and treatment can prevent severe complications and potentially catch life-threatening diseases in their early treatable stages. Reason number 3, changes in your diet, usually temporary. Sometimes floating poop is simply a temporary response to changes in your diet, and it will resolve on its own once your digestive system adjusts or you return to your normal eating patterns. This is usually not a cause for concern unless it persists for more than a week or two. Sudden increases in dietary fiber can cause temporary floating stools as your gut bacteria ramp up their fermentation activity to break down all that extra fiber, producing more gas than usual. If you recently started eating much more vegetables, fruits, whole grains, beans, or legumes, or if you started taking fiber supplements, you might notice your poop floats for a few days to a couple weeks until your digestive system adapts to the increased fiber load. This is actually a good thing overall because fiber is incredibly important for gut health, regular bowel movements, feeding beneficial bacteria, and preventing diseases like colorectal cancer. However, the temporary side effect can be extra gas and floating stools until your system adjusts. The solution is to increase fiber gradually rather than all at once, giving your gut bacteria time to adapt without creating excessive gas. High-fat meals, especially if you don't normally eat a lot of fat, can temporarily overwhelm your digestive system's ability to break down and absorb all that fat efficiently. If you recently had an unusually greasy meal, think deep-fried foods, fatty cuts of meat, heavy cream sauces, or rich desserts, some of that fat might pass through partially undigested, causing your next bowel movement to float. However, this should be a one-time occurrence after that specific meal. If you're eating high-fat foods regularly and your poop consistently floats, that's no longer just about a single meal. That indicates true fat malabsorption that needs medical evaluation, as discussed in the previous section. Artificial sweeteners and sugar alcohols found in sugar-free gum, candies, protein bars, and diet products can cause floating stools because they are not fully absorbed in your small intestine. They travel to your colon where bacteria ferment them, producing excessive gas and often causing loose floating stools along with bloating and discomfort. Common culprits include sorbitol, xylitol, mannitol, and erythritol. If you recently started using a lot of sugar-free products and your poop started floating, try eliminating these products and see if the problem resolves. If it does, you've found your answer. Dairy products, especially if you have any degree of lactose intolerance, which is extremely common and often undiagnosed, can cause floating stools due to fermentation of undigested lactose in your colon, producing excess gas. The floating stools might also be loose or diarrhea-like, and you'll probably experience bloating, gas, and cramping as well. Try eliminating dairy for a week and see if your symptoms improve. If they do, you likely have lactose intolerance and should either avoid dairy, use lactose-free products, or take lactase enzyme supplements when you consume dairy. The key to determining if diet is the cause is paying attention to timing and patterns. Did your poop start floating right after a dietary change? Does it only happen after eating certain foods? Does it resolve when you eliminate those foods? If yes to these questions and you have no other concerning symptoms, it's probably just dietary and not a medical problem. However, if floating continues for more than 2 weeks despite dietary adjustments, or if you develop other symptoms like weight loss, abdominal pain, or changes in stool color or smell, then it's no longer just about diet. It's time to see a doctor for evaluation. Reason number 4, gastrointestinal infections, temporary but needs attention. Certain gastrointestinal infections can cause floating stools, usually accompanied by other unpleasant symptoms that make it pretty obvious you're sick. These infections cause increased gas production, rapid transit time, and sometimes fat malabsorption that results in floating, loose, or watery stools. Giardia is a parasitic infection you get from contaminated water, whether from streams while hiking or camping, swimming pools, or even municipal water systems during outbreaks. Giardia causes distinctively greasy, floating, foul-smelling diarrhea that people describe as absolutely horrible. The parasite damages your intestinal lining, interfering with fat and nutrient absorption, causing steatorrhea along with severe gas, bloating, abdominal cramps, nausea, and weight loss. Giardia doesn't go away on its own. It requires anti-parasitic medication like metronidazole or tinidazole. If you have floating, greasy, explosive diarrhea after drinking untreated water or traveling to areas with poor sanitation, get tested and treated for Giardia immediately. Bacterial gastroenteritis from bacteria like Salmonella, Campylobacter, or pathogenic E. coli can cause floating, loose stools due to increased gas production and rapid intestinal transit. You'll typically have other obvious symptoms like severe cramping, fever, nausea, vomiting, and general feeling of being sick. Most bacterial gastroenteritis resolves on its own within a few days, but severe cases or certain bacteria like C. difficile require antibiotic treatment. Viral gastroenteritis, stomach flu from norovirus or rotavirus, causes watery, sometimes floating diarrhea due to rapid transit and gas, along with violent vomiting, cramping, fever, and misery. These typically resolve within 24 to 72 hours, but require careful attention to hydration to prevent dangerous dehydration. Small intestinal bacterial overgrowth, SIBO, is when bacteria that normally live in your colon migrate up into your small intestine where they don't belong. These bacteria ferment food prematurely, producing excessive gas that causes severe bloating and floating stools. SIBO also can interfere with fat absorption, causing fatty floating stools in addition to the gas-related floating. SIBO symptoms include floating stools, severe bloating especially after eating, excessive belching, abdominal pain and cramping, diarrhea or constipation, and weight loss. SIBO requires specific antibiotic treatment and often dietary changes to prevent recurrence. The key difference between infection-related floating and more serious chronic causes is the acute onset and accompanying symptoms. Infections typically come on suddenly, make you feel obviously sick, and resolve within days to a couple weeks with or without treatment. If your floating stools started suddenly, you feel unwell, and you have fever, vomiting, severe cramping, or recent exposure to contaminated food or water, you probably have an infection. See a doctor for testing and treatment, especially if symptoms are severe. You see blood in your stool, you're becoming dehydrated, or symptoms persist beyond a few days. Most infections are treatable with proper medication and supportive care. However, if floating stools started gradually, have persisted for weeks or months, and you don't feel acutely ill, it's probably not an infection. It's one of the chronic malabsorption conditions discussed earlier that requires different evaluation and treatment. Reason number 5. Underlying serious diseases. Don't ignore these warning signs. This is the most frightening but most important reason we need to discuss. Persistent floating stools can be an early warning sign of serious, potentially life-threatening digestive diseases that require immediate medical attention and treatment. Pancreatic cancer is one of the deadliest cancers, with extremely low survival rates primarily because it's usually caught very late when it's already spread. Early pancreatic cancer often has few obvious symptoms, but steatorrhea, floating, greasy, pale, foul-smelling stools, is one of the earliest warning signs that something is wrong with your pancreas. Other early symptoms of pancreatic cancer include unexplained weight loss, loss of appetite, vague upper abdominal or back pain, new-onset diabetes in older adults, and jaundice, yellowing of skin and eyes, if the tumor blocks bile ducts. If you're over 50 years old with new-onset floating, greasy stools, plus any of these other symptoms, see a gastroenterologist immediately for imaging and evaluation. Early detection is absolutely critical. Chronic pancreatitis from long-term alcohol abuse or repeated acute pancreatitis causes permanent damage to your pancreas, progressively destroying the cells that produce digestive enzymes. As the disease advances, you develop pancreatic insufficiency, causing steatorrhea and floating stools. You'll also typically have chronic upper abdominal pain that may radiate to your back, weight loss, and eventually diabetes, as insulin-producing cells are also destroyed. Chronic pancreatitis requires enzyme replacement therapy, pain management, and addressing the underlying cause. Most importantly, completely stopping alcohol consumption. If that's the cause, without treatment, it causes severe malnutrition and dramatically increases pancreatic cancer risk. Cystic fibrosis, CF, is a genetic disease that affects multiple organs, including the lungs and pancreas. People with CF produce abnormally thick mucus that blocks pancreatic ducts, preventing digestive enzymes from reaching the intestines. This causes severe steatorrhea, floating greasy stools, poor growth in children, and malnutrition despite eating large amounts of food. While CF is usually diagnosed in childhood, some milder forms aren't identified until adolescence or even adulthood. If you've had floating greasy stools your entire life, along with chronic respiratory problems and poor weight gain, you might have undiagnosed CF and need genetic testing and specialized treatment. Celiac disease causes your immune system to attack your small intestine when you eat gluten, progressively destroying the nutrient-absorbing villi. This causes severe malabsorption of fats, vitamins, and other nutrients, resulting in steatorrhea, floating stools, chronic diarrhea, severe weight loss, anemia, bone loss, neurological problems, and increased cancer risk if untreated. The only treatment is strict lifelong avoidance of all gluten, no wheat, barley, or rye. With a gluten-free diet, the intestinal damage heals, absorption improves, and floating stools resolve. But you must get properly diagnosed first through blood tests and intestinal biopsy before starting the gluten-free diet, because once you eliminate gluten, the tests become unreliable. Crohn's disease and ulcerative colitis, inflammatory bowel diseases, cause chronic inflammation and damage to your digestive tract that can severely impair fat and nutrient absorption, especially if inflammation affects your small intestine. You'll have persistent floating stools, chronic diarrhea, often with blood or mucus, severe abdominal pain and cramping, weight loss, fatigue, and potential complications like fistulas or strictures. IBD requires ongoing medical management with anti-inflammatory medications, immunosuppressants, or biologic drugs to control inflammation and prevent permanent damage. Untreated, it significantly increases colorectal cancer risk and can cause life-threatening complications. Liver disease, including cirrhosis from alcohol, hepatitis, or other causes, reduces bile production needed for fat digestion. Advanced liver disease causes pale, floating, greasy stools, along with jaundice, abdominal swelling from fluid, easy bruising, confusion, and extreme fatigue. Liver disease can be life-threatening and requires immediate medical intervention. The critical message here is: don't ignore persistent floating stools, especially when accompanied by other warning signs. Red flags that require immediate medical evaluation include floating, greasy, pale, foul-smelling stools that persist for more than 2 weeks, unexplained weight loss of 10+ pounds, persistent abdominal pain, jaundice, yellowing of skin or eyes, blood in stool, red or black tarry, chronic diarrhea, extreme fatigue and weakness, loss of appetite, or family history of digestive cancers or diseases. These symptoms could indicate serious diseases that are much more treatable when caught early. Don't let embarrassment or fear prevent you from seeking medical help. Your life literally could depend on getting evaluated and diagnosed promptly. All in all, whether your poop floats or sinks is important information about your digestive health, fat absorption, gut bacteria, and potentially serious underlying diseases. It's not just a weird bathroom quirk to laugh about or be embarrassed by. It's valuable medical data that you should pay attention to and not dismiss or ignore. The 5 major causes we discussed: excess gas, usually harmless; fat malabsorption, serious; dietary changes, temporary; infections, treatable; and serious diseases, life-threatening if ignored, represent a spectrum from completely benign to extremely dangerous. Understanding the difference and knowing when to seek medical help could literally save your life. Occasional floating poop from gas or dietary changes is usually nothing to worry about. But persistent floating stools, especially when greasy, pale, foul-smelling, or accompanied by other symptoms like weight loss, pain, or changes in bowel habits, is a red flag that demands medical evaluation. You can and should take a sample of your stool to your doctor for comprehensive testing, including stool fat analysis, enzyme levels, and other diagnostic tests to determine the exact cause. So it won't do you any harm and could save your life, to check your floating poop seriously rather than just being embarrassed and ignoring it. Moreover, you should keep track of your bowel movement patterns, stool appearance, color, consistency, whether it floats or sinks, what you're eating, and any other symptoms that accompany the floating stools. All these things are valuable data about your digestive health and can have a great and significant effect on your overall health, early disease detection, and even your survival. Stop being embarrassed, folks. Whether your poop floats or sinks is important health information. If it's consistently floating, and especially if it looks greasy, pale, or smells terrible, don't ignore it. Don't just flush it away and pretend everything's fine. Investigate it. Get medical evaluation. It could be something simple and easily treatable, or it could be your body's early warning system potentially saving your life from a serious disease. Did this video open your eyes and maybe gross you out a little? Hit the like button right now and subscribe to our channel for more honest, potentially life-saving health information that nobody else wants to talk about, but everyone needs to know. Thanks for watching. Your wellness is our mission.